so much, Mr. Chairman, and thank you to our witnesses. This is a challenging time over the last 3 years, and I admire your patience. I can't help but think, honestly, if the former president had just taken the vaccine on television in January when he apparently took it in private, a million, thousands of lives could have been saved. So I'm grateful for all that you do. It's been 3 years since COVID-19 flipped our lives upside down and changed our world, and I want to acknowledge what the federal government has accomplished to save lives and keep our economy safe, as well as identify areas for improvement. And I thank Mr. Bouchon for his comments that under several administrations you've been challenged, and I think we can work together going forward. So I want to focus on two specific issues. First, the need to improve collection of real-time data to help us assess pandemic threats. And second, the need to facilitate data sharing to enhance our responsiveness to pandemics and other public health challenges. At the start of the pandemic, the U.S. did not have an efficient system for collecting real-time data. This made it difficult for public health officials to understand how to respond to the pandemic. Recognizing this challenge, this Congress invested billions of dollars to build, update, and modernize data systems that served as the backbone of our pandemic response efforts. The American Rescue Plan provided billions of dollars in funding to support a whole range of COVID-19 vaccine activities that we've discussed today, including improvements to information technology to enhance the quality and availability of real-time data at the federal, state, and local level. This funding was vital, but we need a common framework that guides us through these investments. Last Congress, I worked on bipartisan legislation to provide such a framework through immunization infrastructure modernization. Dr. Walensky, why is safe and secure collecting and reporting of public health data so important, even beyond COVID, and what has hindered state and local health departments from bringing their systems into the 21st century?
Yeah, I appreciate all of your efforts here, especially in immunization. What I can tell you is through our data modernization efforts, we're standardizing how data are collected, and we're creating similar highways so that data from jurisdictions from your districts can come into CDC, and then we can deliver them back to you in real time. You can see what's happening around you. Some of the limitations that we have, maybe I'll just say, those efforts have been successful. Prior to the pandemic, we had 187 healthcare facilities that could give us real-time data. We now have 22,000. We're not where we need to be, but because of those efforts, at the beginning of the Mpox outbreak, we had 28 states that could actually give us data electronically, and we were getting them in real time. Oregon Health Community Center has saved 140,000 person hours because they're no longer submitting to us data by fax. So those data modernization efforts are paying off. We need congressional help in our data authorities. It took us 6 months to get data use agreements in the beginning of COVID-19. It took us 3 months to get data use agreements in the beginning of the Mpox outbreak so we could see how immunizations were rolling out in communities. Those immunization efforts specifically help us see where we need to do further outreach. Are vaccines reaching where the disease is? Where do we need to do further outreach? And important, those immunization data provide us opportunities to provide you back the information that you want, which is, do these vaccines work? It is because of those immunization data that we were able to be the first in the world to provide vaccine performance on the Jynneos vaccine. Thank you.
Great. So the second problem with you have the data is data sharing. We need a clear need for efficient data sharing between all sectors, the public, public health leaders, government, to ensure that healthcare resources are directed to those communities most in need. Recognizing there are barriers to complete integration, what can Congress do to help facilitate better data exchange needed to respond appropriately to the next pandemic?
So that would specifically be the data authorities. So data authorities in immunizations, data authorities, to this day, I can't tell you who's immunized in the hospital. And we are going to lose our capacity to look at laboratory testing in COVID-19 at the end of the public health emergency. So it is those data authorities, the sharing of data from local districts to the states, to CDC, so that we can fluidly share it back to you, so you know what pathogens may be knocking on your front door.
Terrific. Thank you. I look forward to working on a bipartisan basis to get that passed. Thank you.
Thank you
I
so
yield
much.
back.